Indeed, my name is Margo, and I'm from Ghent University, specifically from the Sustainable Materials Science group. And today I'm presenting you my work on some toughness tests that we did on a pipeline steel. Before I start, I would also like to acknowledge and thank the collaboration with Suze Laboratory, also from Ghent University, which was instrumental in doing this research, and also the funding from Research Foundation Flanders. So to jump right in, I'm bringing back this picture of the European hydrogen backbone, which is the plan of really making a fully network to spread hydrogen around Europe. And in this plan, it is meant to really repurpose the natural gas pipelines that are in use right now. So you can see a very big portion of this map is covered in repurposed pipelines, or that pipelines should be repurposed. Of course, this is a historical network. There's tons of differences in the years these pipelines are produced, the type of grade, all these different kind of chemistries and microstructures that we can find in the network. So we need to have a good method and a good way of reliably assessing these pipelines for their service in hydrogen. And specifically here, I will be focusing on toughness, which is an important parameter for pipelines. Specifically, I worked on X70 grade pipeline steel, which was actually in service for 30 years as a natural gas pipeline, and was excavated. And we're looking at actually a quite modern, or at least relatively clean, relatively low carbon, niobium vanadium microalloyed steel with a nice rolling texture, mostly banded ferrite pearlite, but also in the center we can find a quite pronounced segregation region where we can find some different microstructures, and very specifically some harder microstructures. So we're looking at bainite, martensite, austenite islands, and also very large niobium precipitates, and some elongated manganese sulfide. Excuse me. So some interesting microstructural elements that can be quite dangerous in the segregation region. For experimental methods, I worked with the single edge notch tension specimens, the SENTs, I will call them for short. And we actually tested two orientations. So we put the notch either along the bands or perpendicular to the bands, which I've named here LT and LS. So the crack will grow actually in the T direction or the S direction over the pipeline. And then on the right, you can see the two kind of environments that I use. So we have an in situ cell we built for actually doing the toughness test with in situ electrochemical hydrogen charging, and of course just ex situ after pre-charging. For the resistance curve, we are monitoring CTOD with a double clip gauge method. You can see the clip gauges there on the in situ chamber, and also doing DCPD to monitor crack extension.
I will continue.
And then finally, I will be evaluating the effect of hydrogen using two methods, mainly, which is just fructography, and then also X-ray micro-CT scanning to take a look in the volume, to look at voids. I will be starting with the LST specimens because I think they give a good overview of the kind of three main spheres of influence of hydrogen in these types of specimens that could be identified. And I put here some embrittlement indices just to show you a bit the very well-known effect of the hydrogen concentration. But mostly for these specimens, I want to focus on the three influences, which was splitting, crack initiation and blunting, and the crack extension or the tearing region, which was all influenced by hydrogen. For splitting, you can already see, because this is LT, the splits will be going along the crack extension. So we'll actually be splitting the crack front in two. And here we could not really find a trend except for the higher hydrogen concentration where really every specimen was splitted. But for the lower hydrogen concentration, this was not really observed. But we also did Sharpie testing where we could see a really clear trend where if you charge with hydrogen, and then at the higher temperatures, the Sharpie test did have more LT, splitting in LT. Then for the initiation, on the far left for you, you can see like a normal blunting zone or a stretch zone. But if we take a look in hydrogen, actually there are some changes. Very small regions just past the fatigue crack of quasi-cleavage. And this region becomes bigger the higher the hydrogen concentration becomes. But then we do transition back to a ductile mode of crack extension. For the crack extension then, on the fractography, we can find a lot of quasi-cleavage regions. They're often linked to some inclusions or maybe the bands, because as you can see in the highest hydrogen specimen, we did have some quasi-cleavage actually extending ahead of the main crack front. And then we could identify there this bainitic band, which is likely where the quasi-cleavage grew. For the splits I mentioned, there was no really trend with the lower hydrogen concentration, and this bears out in the appearance. The splits always look like a mix of this very fine faceted region with the MNS, which is of course the bainitic bands, which had the flat MNS, and also very large facets, which are probably large ferrite grains, which are also in the vicinity of these bainitic bands. So clearly splitting in these specimens is associated with the segregation region. Then for the CT scanning, what we can see here is that as the hydrogen content grew bigger, also we see a very pronounced increase in void volume fraction. So we're creating ahead of the crack more voids. These are reconstructed volumes, so the red areas are actually open volume in the specimen. And this is also something we could see in smooth round bar specimens, so simple tensile tests with hydrogen or without hydrogen. We can see that the voids start to appear at lower strains. So this is some kind of enhanced void nucleation of because of hydrogen. Also, if we look at the CT scans, we can take a look at actually the shape of the crack path. And what happens with hydrogen is that this crack grows more in a more jagged or more zigzag way. And if we link this to the fracture surface, we can actually see that those peaks and valleys in the zigzag crack path do correspond with regions of quasi-cleavage on the fracture surface. So clearly, the quasi-cleavage really participates in the crack growth. Then for in situ testing, still LT, there's a big change. You can see it on the right specimen here, and that there's almost no microvoid coalescence left. But actually, the resistance curve looks not that bad. I think this is, if you would average it, it's a reduction of 24%. But if you look at the normalized scores, it is quite a reduction. And if we take a look at camera images taken during the test at a CTOD of 0.1 millimeters, we can see that for air on top and ex situ below, there is no crack extension visible, but for the in situ charging, we already have at the edge this tiny bit of crack extension at the 0.1 millimeter CTOD. And then looking further at the fracture surface, there is no blunting visible. So the fatigue pre-crack just goes immediately into quasi-cleavage, and this continues except for a tiny bit of ductile fracture right at the end in the middle. And we also see in the CT scans that we have very pronounced crack branching. You can also see it here on the top. There's actually multiple cracks growing during the test. Here we have from the edge of the specimen, and this is more from the middle. These are very sharp cracks, but it doesn't really show in the resistance curve. And of course, we are measuring with the double clip gauge method, so we cannot really capture this, I guess, crack opening when we are actually seeing the crack opening here. This kind of phenomenon is also a bit happening in the ex situ tests because we have no side grooves in these in situ tested specimens, so we need also ex situ without side grooves to have a fair comparison. And we can see at the edge, because of the stress state there, we do have a tiny bit of a branching crack, but in the center, it is a single crack. So there's no really branching in the ex situ tests. Yeah, so this means we are likely overestimating our CTOD just by our double clip gauge method. And then finally, the LS. So now we are growing our crack not along the bands, but actually right onto the bands. And what happens now is that ex situ we actually get an improved curve. But this is, well, a bit of an illusion, because what happens is there is a split actually happening right at the end of the fatigue crack. So you can see when we interrupt it at a 90% maximum force, right? So before maximum force, not after. Right at the end of the fatigue pre-crack, there is a split happening. And if we then interrupt the test at maximum force, the crack has grown beyond it. But of course, this split will have, again, made our CTUD measurement, well, will have retarded the crack growth, because it's our crack arresting splits. And then if we look at the voids, we can see they are nice aligned again in a band, and no surprise, again, this is the bayonetic bands. If we then look at the cross section, and we can see void formation happening in these bayonetic bands. For the in situ tests, this is like a combination of all effects. So we have the crack branching, which is very specific to in situ, but we also have these crack arresting splits. And if we look at the cross section, you can see that actually the CT scan captures only the start, and there's much more fine cracks growing along the bands in these specimens. With that, I will give a very short summary. So we clearly identified a very hydrogen sensitive segregation zone in this type of material, with the bayonetic bands, with the manganese sulfide, with the martensite austenite components. We saw hydrogen enhanced splitting for both orientations, but mostly for the LS, this had a big influence because these are crack arresting splits. And then for the big differences between in situ and ex situ, we see that in situ, there's no blunting almost, there's complete quasi-cleavage of the fracture region, of the crack growth region, and there is crack branching regardless of the specimen orientation. For the ex situ tests, we can see a partial shift to quasi-cleavage in the blunting zone, so clearly the crack initiation is affected, and the crack zone is a mixed fracture mode, and we also see the enhanced void formation in our X-ray CTs. With that, I thank you for your attention.
All right. Thank you very much. Is there any question? Yeah, Rose?
Thank you for a very nice presentation. I have one question. You mentioned that during access, you have a little bit less of coverage. Could you compare the hydrogen concentration during exit in situ and correlate with the difference in fracture mode and the fact that during in situ there is no void initiation as much as in the case of in situ?
Yeah, so obviously for ex situ testing, we are, of course, losing hydrogen during the test, and for in situ, we are replenishing it. So I should mention, maybe in case it wasn't clear, the in situ specimens were also pre-charged. So the hydrogen concentrations that I show are initial ones. So this is the start of the test, and then of course ex situ you will lose some of that at the edge. In situ you will still keep replenishing it. For the fracture mode, of course, quasi-cleavage is quasi-cleavage. It's just that clearly, if you have this access to hydrogen right at your crack tip, right at your fatigue pre-crack, it's easy to grow really there via quasi-cleavage. Also, the fact that, I guess I can show, the fact that we see maybe in our in situ tests, I don't know if I actually put the picture, we see maybe less void formation in the in situ tests because these crack branches are all connecting the voids, because the red areas are of course open volume, so completely surrounded by steel. If they connect to the air somewhere, the CT scan will not really pick it up in this kind of picture. So it can be that we still have this increased void
very short question.
Yeah.
So that's great. Your work is excellent. Thank you. And just a question is, when you observe the void enhancement by hydrogen, so is there any relationship of the void generation site relative to the pathological microstructure? or it's generated randomly?
No, so the void generation, first of all, it's very linked to actually, it's not random, it's very linked to the equivalent plastic strain. So we can actually see this kind of two wings of the butterfly. So that's the region where we really get this enhanced void formation. And also it is a lot at the inclusions, which is where you normally get the voids, but also especially where we get the really big ones that really show in the CT scans, the hard bands are very sensitive. I think especially the Martensite Islands, because they have the very large strain incompatibility with the surrounding matrix.
Okay, excellent. Thank you very much. All right, thank you. 1 minute. Who knows? Oh, no, yes. Right now.
Leonardo, please.